Yeah. Give an old man a mobile phone to read.
Good afternoon, team. How are you, everyone? Thanks, Joe, sir, once again for creating this platform and creating this opportunity, and also a place where we can share our minds and also define where the next generation of people and ICT has to go, right? Check, check, check. So I'm from a company called Teslon. It's a healthcare tech company. Whatever we do in the healthcare space, we call it as Care Nation, Care for the Nation, right? So that's the name and the brand for the healthcare initiative, whatever we do. So what are we, right? That's an interesting thing. So probably it's good that my session is the last, right? There is no need to demonstrate or explain or set the base of the context. We are a 360-degree of healthcare, right? So the primary focus of building Care Nation is continuity of care, and we think patient as epicentric here, and we cover the entire journey of a patient. What really that means is a patient from his home or his clinic or he has been discharged or how do he is taken care as a wellness and everything in a single platform, right? I'm going to explain what are we doing. The first block, what we call it as smart kiosk. So it's a drop-in replacement of a hospital itself, right? We are telling ICT peoples and the bigger smarter city, no need to start investing on heavily on creating physical infrastructure, which is not going to scale whatever the ROI they are looking for, right? If you're running a hospital, the important thing is footfall generation is a very important thing for any hospital, right? So if you are creating a huge investment of hospital where you need a lot of physical space, nurse, a lot of medical devices and other things where it runs into several crores. So the first solution, which is called kiosk, it's a drop-in replacement of a hub and spoke. Just within few lakhs of rupees, you are able to create a virtual hospital. By introducing this, what the hospitals and governments are solving is they have the reach, the medical reach is given to the citizen, end citizen, wherever it is, right? Especially in India, it's working out very good. We are there as a global player, we are into multiple countries and other things. I'll be touching everything in detail as well. The second use case is more into the EICU and other use cases. Lot of government people and even Indian government as well as Karnataka state government and other things had adapted a lot of this technology during the COVID era also. So thousands of people easily been served in the COVID ward using these technologies, right? So we were there during the COVID war, right? So all these patients in either Victoria, KC General or Chhattisgarh government, wherever it is, right? So the care is being, the best of care is being given through this sort of platform, right? Of course, we are into medical dispensing and other things. Lot of people had spoke about AI. Of course, we are in the data collection layer, and all the devices are fully integrated into the space. So we have all the data, and we do have immense AI processing. Our vision here is quite modest. We use AI for in the era of screening, right? Especially heavily populated country like India, wherever we run a camp, thousands of people will subscribe and come for the camps. But do we have physicians to screen all these things? There is absolutely no. And if they screen it, it happens after 2-3 months and other things. After that, the time is waste and not any impact is being created. The system is there on the backside. It understands all the report. I think we had Neura and other people spoke about the AI. We are doing it already. So it gives the top priority patients needs to be picked up in the list, and how do we address them as well. The last and very interesting piece is the personal health space, right? So that I will touch about and explain also. So whatever you see from the left side is a huge array of portfolios and products which is really specifically concentrated on a healthcare space. We do have backpacks for military use cases, we do artificial intelligence, We do have our EMR, and healthcare monitoring is another important aspect which we work with a lot of different governments and other things all across the globe. We are there in a lot of others, wherever you call it as healthcare, right? There is our contribution to the technology thing is there. So already we are into quite a few smart cities in India as well. We are driving a couple of smart cities in India as well, and other global smart cities also we are driving it. So this gives you a comprehensive customer base as well as where are the different countries we are in. So the primary reason for showing the country thing is it's very important in the healthcare space. You need to adhere to a lot of standards, which is quite interesting, right? So if you go to the FDA, HIPAA and other things, if you are in Europe, GDPR compliances, of course, in India, there is a lot of compliances are there. So making a product which is compliant all across globe is very important. Safety and security of the patient is the paradigm for any product development in India, right? So that's the reason we are able to touch multiple people, multiple countries, and we are able to touch different lives as well. So I'll put my first product, which is called Express. It's a very lightweight replacement for any hospital to touch the waters, get into the telemedicine or teleconsultation. So a lot of hospitals during the pandemic, they were not able to get the patients in, a lot of public player, even government hospitals. So they introduced this product. So this made them to establish all the patients' flow, right? It's well connecting all the physicians and other things in a single platform. It's the only product which it's fully compliant to Ministry of Health Family Welfare guidelines as well. So it gives you a very comprehensive platform. We insert one single URL to their portal. Post that, they can pick their doctors, they can do payments, a single SMS will be sent to them, and during the exact time you can click the SMS and your conversation and your consultation with the physicians will happen as well. Very comprehensive platform. The next platform is more into the previous one, we call it as transactional telemedicine, right? So transaction telemedicine is you make an appointment, you speak, and it's got over. So, but in the second product is more of a continuity of care needs to be done, right? You need to be monitored. A lot of people are speaking about wellness, we were preventive health, geriatric care, and other things, right? It's little different where you need to be continuously monitoring people, right? So it's a very smart system. What will typically happen is those are installed, they will have the system, and a lot of medical devices are fully connected, and you are being continuously monitored by the caregiver team at different locations and other things. So that is a thing, and of course this is the drop-in replacement. We are running in Greece, we are running more than 75 airlines, which is connected to 14 mainland hospitals. So pretty much all the digital ecosystem is fully connected through our solution. We are, especially during COVID, we are seeing a lot of things happening on the telemedicine and smart solutions, right? So we are into eICU as a important thing. So as we are into the healthcare IoT play, so we know how to make sure all that seamless devices integrations, and we are able to pick the data from devices. So we are into the next level of even predicting seizures. We can tell what sort of mortality will happen, what sort of alerts needs to be given to the physicians and other things in advance itself, right? That is possible. We are also into robotic ICUs, right? So especially COVID had taught a lot of things for everyone, right? So physicians cannot enter. A lot of places you need, doctors needs to have interaction, but as much as they need to reduce the risk thing, right? So we have created our robotic things which can go rover either on a map or just remote control based, and it can go and it can enable the full-fledged consultations as well. So as extension to that, we do have complete nurse calling systems, then patient monitoring, alerting, everything has been deployed, and it's available as part of thing. We're also into the next generation of connected ambulances. If you see the statistics, out of 10, at least 2 patients die in ambulances because not enough care is being given, right? So it matters a lot, especially you are in a transit, the position matters, what are the instruction the hospital team is rendering to the nurse or paramedic inside the ambulance matters. So we have that, including your entire fleet management and other things. So that's the thing. So we do in, especially in North Indian context and a lot of rural context, we run virtual hospitals through backpack sort of solution, right? They go, they address rural health people. They address their on door-to-door services, Anganwadi people and other things. Yeah, of course, medical dispensers and other things, huge variety of medical devices are fully integrated into the solution. So you're not going to create anything new. So a lot of things are fully integrated into this. So a huge variety of comprehensive portfolio is there. With the team's permission, I'd like to show a quick video so that it can summarize everything, and I can stop my thing, and I'm happy to take all your questions.
The shortage of both medical personnel and resources all over the world is not a factor that needs any explanation anymore.
Number one problem in India is rural health is being discarded. The second problem is the spending. The third problem is the availability of the doctors. The nurse and other paramedic staff is not adequate in India.
The need to provide access to limited medical resources in short periods of time is very, very important.
Teslon primarily aims to solve the challenges with accessibility of care. And along with that, we also focus on the two other dimensions, which is the quality of care and also the reduction of cost of care. CareNation is our primary offering, and it's a platform that enables access to care for patients who are remote and also provides that experience that is as close to possible as an in-person consultation.
We started from a core THC replacement, we call it as telemedicine kiosk. Then we emerged into eICU. We have solutions for augmenting doctors' capacity using AI and machine learning technology.
They came with that unique idea which we never used to practice in past. It saved a lot of time, energy, resources, and even the human efforts.
Teslon CareNation card helps us in telemedicine treatment. So instead of directly exposing the doctors and our staff to the patient, especially in the COVID scenario, we can directly treat the patient over this card without much exposure. I think we have almost treated from 3,000 to 7,000 patients in ICU or container ICU or step-down ICU or isolation wards.
In addition, help us addressing a scarcity of medical professionals. It is an important tool in addressing the shortage of medical professionals.
With the kind of solution CareNation is, it is heavily dependent on a robust networking infrastructure as well as a collaboration that is high quality. And Cisco, being the global leader in both these verticals, networking and collaboration, forms the right mix.
Yeah, I think I like to thank this opportunity, and probably everyone in this room is very important, because pulling this endurance is not that easy. Everyone have a responsibility here where we need to make a bigger contribution for all our social needs. We are happy to help, and probably we are happy to work with everyone and take it to the next thing. Yeah.